Okay. All right, good morning, everyone. It is Monday, April 20th, 2020. I'm Adam Mayberry. I'm the lead public information officer for the Joint Information Center for the COVID-19 response here in Washoe County, supporting City of Sparks, City of Reno, Washoe County, and the Health District. These are our standing virtual pressers, Monday, Wednesday, and Friday. Haven't sent out an advisory. Should have a calendar invite, though. Feel free to forward those or share those with anybody that should be on this call. It's really intended for our media partners with provide you some timely information, have an opportunity for you to ask questions. So again, we'll do this. We'll do this today. We'll do this Wednesday and Friday at 11:30. Today we will just have our health officer on the line today. Later this week on Friday, and the health officer, Kevin Dick, will be on with us on all of our pressers for a health update, any questions you have, since this is a health crisis. Friday, we intend to have the registrar of voters on, talk about the primary election season and the mail-in voting and that. So you may want to tune in for that one. We're looking to find some additional timely speakers for Wednesday as well. Next week, we'll probably scale back these pressers to just Wednesday and Friday for a little while. Our Joint Information Center will sort of return back to the jurisdictions with health kind of leading that effort later next week. I don't want to say we're eliminating the Joint Information Center, because we're not, but I think we're in a position where we're moving in the right direction. And we have a lot of the public information infrastructure, if you will, in place. So and I'll take a back seat to that later next week. But for this week, it's a status quo for us. And I would like to also point out through chat, I sent you a link to the COVID-19 Washoe website. It is for a link to our media resources. There's a lot of branded graphics, videos, PSAs that we produce as a region. Be delighted for you guys to share that to the extent that you can. A lot of short, succinct videos, how-to videos, things as simple as pumping your gas or going to the grocery store, and how to do it safely given the COVID-19 pandemic. Hat tip to City Sparks and Reno and the county for putting those videos together. They're very informative, very well done. So I hope that you can find those as a resource, particularly here in Washoe County. If you're in Las Vegas, you're not allowed to use them. Just here in Washoe County. No, I'm just kidding. Just kidding. Anyways, so we will transition to our health update from Kevin Dick. Good morning, Kevin.
Good morning, Adam, and thanks everyone for joining the briefing today. I'm Kevin Dick, District Health Officer, and have some updates on case counts today. We're reporting 25 additional cases of COVID-19 in Washoe County. That brings our total case count to 662. Sadly, we reported 2 additional deaths yesterday. That brings our deaths to 18 for Washoe County. We have 15 additional recoveries that we're reporting today. So that brings our recoveries to a total of 166. We have 477 active cases in Washoe County, and of those, 43 individuals are hospitalized. And we have 37 of our cases that have been discharged from the hospital. Our hospitals continue to have good capacity available. As of April 18th, the Hospital Association has reported to us we have 56% of our licensed and staffed acute care hospital beds are occupied. 55% of the intensive care unit beds are occupied, and we have 20% of ventilators are in use in our Washoe County hospitals. We continue to operate the call center in conjunction with REMSA to help people to get access to testing. So people that have symptoms, you can contact our call center or visit our website, and we have a risk assessment portal that you can fill out some questions in a SurveyMonkey format. We have that available in both English and Spanish language, and we're able to collect that information and schedule for testing right over the website electronically, or you can call our 328-2427 number and go through that risk assessment process over the phone. A reminder that all of our drive-through testing is free of charge. We do not ask on if somebody has health insurance or if they what their status is as far as whether they may be undocumented or not. So please contact us if you have symptoms or visit our website so that you can have access to that testing. We can determine whether you have COVID-19 or not and how to respond to that appropriately. We are operating the drive-through post for the sample collection for testing today. We expect to have about 230 people get tested today. We operated that on Saturday with 216 people being tested. The National Guard is now deployed with us, and they're assisting us with staffing and operation of the post for that testing sample collection. They're also helping us with call center and case contacts, so integrating into the health district's operations, and we're grateful that the governor has deployed them and that they're here to assist us. The Los Alamos model that I've spoken about previously was updated earlier today. This is one of several different models, but one that we're watching closely that has projections for Nevada as a state. I reported last week that they had told us through their model that they think it's 80% probability that we had reached our peak last week. Today, they're reporting just a slight change, 82% probability that we had reached our peak as of yesterday. They're projecting that as a state, we will, if we haven't already reached our peak, that next week and the following week, or I'm sorry, this week and the following week would be the weeks that they have the highest probability of being our peaks. So we're watching our case count numbers. Being at the peak means that we have the most active cases occurring during this time frame right now. And that's why it's very important that people are following all of the direction for social distancing to attempt to reduce the spread of the disease. That's what we will need for us to come down off of that peak and have lower numbers of cases into the future. Without those practices, we risk either staying at high numbers of cases on a daily basis or having those cases increase. So stay home, please, for Nevada. If you don't have to go out for any essential needs, please remain closed if you're not an essential business. If you are an essential business or somebody who is going out for essential needs, if you're working one of those businesses or visiting one of them, please take the protective measures of wearing a cloth facial covering, wash your hands frequently, clean high contact surfaces, and try to maintain that minimum 6 foot distancing from others to prevent the spread of the disease. We are working to release some maps of where we have COVID cases occurring in the community. It looks like zip code is actually the most feasible way of getting that data presented quickly. And so while we're concerned that people may look at zip code information and presume what risks people have in different areas of town, it's very important to understand that where somebody is, where their residence is, where they're isolating, does not indicate where they contracted the disease. And so you may have areas that show very low rates of COVID-19 because people aren't in their residences recovering there, but they may actually be areas where we've had COVID-19 cases occurring and spreading. So we'll try to make that information available for you, but I wanted to put that caveat on it so it doesn't lead to any false sense of security. We want everybody presuming that while we're in this phase where we may be at our peak, that COVID is out in the community and you can contract it anywhere that you go. And so it's very important to practice those protective measures. We have also continued to receive adequate supply of test collection kits from the Nevada State Public Health Lab at UNR. We also have deployed some of the Abbott rapid DNA testing units. And so we've located them at 3 of our hospitals and with Community Health Alliance as well, our federally qualified health center. So they're available. We have a limited number of cartridges for them initially, but we're working with resupply to be able to continue with a rapid 15-minute turnaround with those test units. So that concludes my update for today. I'd be happy to take any questions.
Thank you, Kevin. And this is Adam. I know on our dashboard, it does say 19 deaths, and that is incorrect. It is 18, has some data issues that we're working through, but currently there is 18 COVID-related deaths in Washoe County, not 19. So we'll open it back up to questions.
Thanks for the clarification.
Hi, Kevin. This is Siobhan from the RGJ. You talked about the surge models for the state. What about the surge models? Do you have surge models here for Washoe County, and do the hospitals have their own surge models that they may be basing things on?
The hospitals have been, or Renown has been operating a surge model from Penn State, and that has shown a reduction over time in what's expected within the surge. The model that's available, COVID Act Now, that gets down to the county level is, we don't feel as useful for us in looking at where we're going to end up, and it's now providing projections for, what if we don't have the social distancing measures in place. So we think that with the situation that Nevada is in, with the social distancing that's occurring and the action that our governor has taken and the compliance with those that direction, that we have the most faith in the Los Alamos model, even though it's not down specifically to the county level.
Thank you.
Hey, Kevin, you had previously said in one of these briefings that it appeared that we were lagging behind at least the Las Vegas area in our peak. Is that still the case, or are we kind of up in line now with what the Los Alamos model is saying statewide?
Our impression has been that we're a little bit behind Clark County, but it's really tough to tell. And so right now we're watching our data on a daily basis. It's looking like we maybe have been peaking or flattening out, but with the variation that we can have from day to day in the population that gets tested, and with the size of our community, there can be a lot more variability when you're looking at what are the results on a daily basis that are coming in from a population of 460,000 people versus smoothing that you might have when you're looking at a larger population of 3.3 million or just over 3 million people for the state. So we're continuing to watch, and we want to be seeing a longer term downward trend before we have any real confidence with where we're at.
And that was the question from Sam Gross with the Reno Gazette-Journal. Is that correct?
Yeah, that's right.
Okay, thanks, Sam.
Kevin, this is Michelle from the Nevada Independent. Can you give us a little more detail on the Abbott rapid testing machines? You mentioned one going to Community Health Alliance. What are they split up between 3 different hospitals? What's the situation there?
Yeah, we received 4 of the Abbott test units, and these are about the size of a toaster, and they are set up to run an individual test and give you results within about 15 minutes or not. This is the DNA amplification test. So it's quite reliable as far as the specificity for COVID-19. Not to be confused with the other Abbott test, which is an antibody test that they have. And that one, we still don't know how specific it is for the COVID-19. The state lab actually received one of those antibody test units, and they're going to be evaluating that this week to determine what they think, how well they think it performs and what it might be used for. That one would show whether somebody had been exposed and developed antibodies. The Abbott rapid test units that I was talking about that we had deployed, they identify the RNA sequence, and they are able to tell us that they are infected with COVID-19. So those were distributed to Renown, St. Mary's, Northern Nevada Medical Center, and Community Health Alliance. And we're hopeful that in the future, we have expansion of availability of these types of tests so that they can be deployed to point of care at healthcare providers throughout our community, similar to how people get tested for flu with the rapid flu tests. So that's our hope for the future for this type of technology.
Can you explain a little bit about how limited those cartridges are? I mean, does each of these machines only have 1 round at this point, and how quickly do we expect more to be coming in?
So what we received with the 15 units statewide was 8 tests for each unit. And the CDC has set up a resupply schedule for us where every 2 weeks we're supposed to receive 120 tests for each unit. So 60 tests per week per unit, roughly, is the pace that we expect to be receiving those cartridges. So that's a very limited supply of those tests. And so the reason we deployed them with the hospitals is to be able to provide that 15-minute turnaround for people that they need to be admitting to the hospital to be able to determine whether they have that COVID-19 and would therefore be separated and cohorted with other COVID-19 patients.
When you join, it should be.
Kevin, this is Jonathan Wright from the Gazette-Journal. I want to quickly follow up on an answer to your question from last Friday's meeting. You stated with respect to the state guidelines for grocery store and convenience store safety best practices that you thought those were guidelines and therefore your office could not enforce them, you thought. If your office can't enforce them, who is going to enforce them, and what is going to be the are there going to be consequences for non-compliance?
Well, that guidance came out of the governor's office.
Right.
And I also on Friday had a session with the chamber members to provide them with updates and answer questions. And they also expressed concerns about facial coverings and that these are just recommendations in other essential business settings where People are seen without wearing the facial coverings and in close proximity to one another, or closer than 6 feet. Based on the questions that I received on Friday, as well as the feedback that I received from chamber members and from their CEO, Ann Silver, that they supported requirements for the facial coverings versus a recommendation that people use them. I communicated that to the governor's office staff on Friday and requested that they and the governor consider moving that from the grocery store guidance to be more of a requirement through a directive, and that the recommendation on facial covering also be put forward as a requirement.
Kevin, you talked specifically about facial coverings. Did you recommend that the guidelines in toto be moved from suggestion to directive, or was it only specifically with respect to facial coverings? What other practices need to be enforced formally?
My suggestion in regards to the grocery stores was that guidance be moved from being just guidance to being requirements.
Are you is your office at all contemplating that, whereas national grocery store chains have an incentive to follow these guidelines now, because they probably have compliance departments for a variety of regulatory issues across the country, wherever they do business, that it's the convenience stores that are going to be the issue, the locally owned convenience stores? Because we've been getting a lot of reader questions at the Gazette Journal that it seems convenience stores are really not complying at all or attempting to significantly. What is your thought on that?
I don't really have that information. We have not been out in the field because we've been busy responding and having our staff participating with the call center and with the post for the sample collection, and with the follow-up with individuals that are either have positive results or giving people negative results. With the National Guard joining us, and they're beginning to provide staffing for those operations today. Now we're looking at getting inspectors back in the field because we haven't even been able to conduct our normal food establishment inspections for preventing spread of foodborne diseases. So as you may understand, we're overwhelmed with this situation, and don't expect the health district to be the entity that's out there enforcing all of the directives at all the businesses that are in our community.
Kevin, this is Michelle from The Independent again. You talk about the health district being overwhelmed with this task. How many people do you have working on contact investigations? How many new people are coming on board, I think you said today, from the National Guard to help with this? And how long is the typical turnaround for one of these investigations?
Well, these investigations, we have numerous people that we have to contact. So we have 25 people today that were identified as new positive cases. Each of those individuals then needs to be interviewed to find out who they had been in contact with going back several days before they exhibited symptoms. Those contacts need to be identified, contact information for them. Then those contacts are assigned to other case contact tracing people, and they then need to contact each of those individuals and work with them on what their plans are for quarantine and monitoring for symptoms to see if from their exposure they develop COVID-19. And of course, the positive case, they need to be in isolation until they recover. So there's a significant amount of work around all of that. We have currently 3 epidemiologists on staff. We're able to bring another epidemiologist on staff next Monday. They're operating with teams of 10 to 11 people that are working with them on the contacts coming back or to the people that were potentially exposed. So it's a significant investment of resource. And it's one that we're going to need to continue to expand upon in the future based on our forward-looking scenario that as we have our cases declining, then we're going to be reopening some of our businesses and our economy that we've closed now for the social distancing purposes. That will mean there's the enhanced opportunity for the spread of disease that we're counteracting right now because of all the social distancing and restrictions that are in place. We'll need to make sure in that scenario that we have more testing available and we have the staff to be able to immediately respond to those tests and to ensure that the positive cases are isolated and the people that potentially have been exposed are quarantined during that incubation period. I don't know what the number is. We're working now with other health authorities in the state with trying to identify the plans for how we'll accomplish that. But I do know, for instance, that Johns Hopkins has estimated something on the order of 100,000 case contact investigators nationally to be responding to this moving forward. Just looking at our population here in Washoe County, that's about 140 people that we would need to conduct that into the future. The entire health district is a little less than 160 FTEs currently. So there's a huge task ahead of us that we're working to start to plan and figure out how we're going to staff that.
Hi, this is Lucia Starbuck from This Is Reno. This is a question for Kevin. Over the weekend, there were a significant amount of people protesting to reopen Nevada in Carson City. And I know a lot of those folks are from the Reno Sparks area. Are you concerned about an outbreak, or are you concerned about an outbreak from that or a spike in cases after that rally happened over the weekend?
I am concerned that if people are not social distancing like we're asking them to, that they can be contributing to further spread of the disease. And I think that some of the congregation that took place down there does pose risk for spread of disease. But that said, that's not the only place that people have been congregating. And we saw the news of some arrests that were made for illegal street racing. And I know that there were people that were congregating at those events that were going on as well. So please, everybody who in our community, I'm asking, please to follow the social distancing guidelines. And while you may not agree with the actions that have been taken with some of the business closures, if you can at least help protect other people from getting sick, that's what I would ask everybody to do.
Thank you.
Hi there, Andy Guevara with 2 News. Got some questions about our nursing homes right now and what challenges you might be facing with those facilities.
So the nursing homes, as we've seen across the country, are particularly vulnerable because of the age of the population that they serve and other underlying medical conditions that they may have. But the state is the licenses those facilities, and so they have the lead in working with them on their outbreak response and control. So we're not engaged directly in those facilities. That's the role that the state has in this.
Okay, so county-wise, nothing to provide them with PPE, anything like that. That's all state led.
They They are tiered in when PPE is available, but until we start seeing significant PPE coming in through the efforts of the governor's task force with the procurement, we're limited with what's available. And I'm grateful that the Reno Fire and REMSA stepped up and provided the Lakeside Health and Wellness Facility with some of their PPE equipment.
Okay, gotcha. All right, so our questions have to go then to the state on this one.
Yes.
All right, thank you.
Hey, Kevin, Scott Sonner at AP. The governor has been very clear that there's no timeline for starting to reopen businesses, and you've outlined a number of steps we are away from doing that. But people generally are curious of the big picture here. Do you think it's impossible that we'd start loosening up some of those restrictions by Memorial Day? Or is it more realistic to think in terms of, say, 4th of July or Labor Day?
I guess I would, I'll take the easy way out on that one and say I think we should be thinking about all of those dates because the way that we're going to need to move forward with this is going to be a series of different actions that are taken that are incremental in how we reopen and what type of businesses and activities we allow to resume at different times. So I think it's important that we be thoughtful in what types of activities and what businesses we open at first, and that we then carefully monitor what's the result of that. Are we able to continue to control the spread and keep our cases low? Or did we do something wrong and now we've got increasing cases occurring? So I guess I would expect over a period of months to have those decisions made that allow gradually more and more businesses to reopen if we do this successfully. Because what we don't want to do is take too big of a step and then have a increase in cases occur that's difficult to get back under control again. We'd like to be successful in how we implement this so that we can continue with the expansion of economic activity.
Perfect. We'll take a few more. We're at our noon hour. I don't want to cut into Kevin's time anymore, but I know these are really helpful. So if somebody hasn't already asked a question and you'd like to, we'd like to hear from you.
Hi, this is Ann from KUNR. My question is for Kevin with regards to the reopening. How vital and how much widespread testing would need for the government to reopen?
So I was having difficulty hearing you on, but I think you were asking me about how much widespread testing are we going to need in order for the economy to reopen?
Yes, correct.
Okay, thanks. I think that's still something we're trying to figure out. I think we know that what we have available now is not sufficient, and that's what our group that's working statewide with the epidemiologists and the labs and our state Division of Public and Behavioral Health are trying to determine. There have been some reports out on the level of testing that would need to occur based on some other public health expert organizations and what they're proposing. And I could tell you that would mean that we would have to at least double, maybe triple or more of the capacity of the testing that we're doing now. So we might need to have a whole separate drive-through testing facility. We'll also need to be having more tests deployed in hotspot sort of locations, health, long-term care facilities, other locations where we're seeing transmission occurring in the community. So those are all, what we're going to need to be able to achieve to stay on top of this as we reopen.
You mentioned earlier that you are already stretched in terms of healthcare capacity of the health district. So in order to see all of that happen, would you need to have more people on board and with more hiring?
We will need to have more personnel involved in those activities. And so, we're also, as we're trying to figure out how we do this moving forward, trying to understand where those resources are going to be available for the dollars to provide that staffing and the individuals that can fulfill those roles. And this is something that is going to be a challenge nationally for every health department across the country to be able to get these personnel. CDC is talking about sending out more of their people in the field, but I don't think CDC is going to solve this problem for us. I think we're going to need to be able to, at the local level, recruit people into these roles, train them, and have them working as our own local army to fight COVID-19.
Thank you. Yeah. Go ahead. Go ahead. Okay. Maybe I had a little echo there, probably hearing myself. I think will conclude today. Kevin, thank you so much for your time as always. As we move into the week, if anybody has any questions or needs some additional follow-up, feel free to contact me directly or any of our regional partners. Again, I'm going to send you a link through chat. Take a look at these our resources that could be used for all of you to help promote our messages, the COVID-19 related messages and videos on our regional website. And to confirm, we do have 18 deaths, not 19 deaths. Our dashboard has been updated to reflect that. If there's no other questions, we will see you on Wednesday at this time.
Thank you.
Thank you all. Thank you, Kevin.
Thank you.